1. A study from South Korea linked 3 new COVID-19 infections to a single person at a restaurant. 2. Researchers discovered that an air conditioner blew SARS-CoV-2 droplets around the restaurant. 3. The study's authors are urging restaurants to be more mindful of their indoor airflow. A new study from researchers in South Korea details how one COVID-19 outbreak at a restaurant managed to impact people who didn't have close contact with an infected person. The study, which was published in the Journal of Korean Medical Science on November 23, analyzed a small outbreak that occurred in June in the city of Jeonju. The outbreak caused 3 infections at a restaurant within a short time. The researchers used personal interviews, data collection on closed-circuit TV images, and cell phone location data to map out where people were seated in the restaurant. Then, they studied airflow direction and velocity, the distance between people who were infected, and how often the people moved. The researchers discovered that a person infected with COVID-19 was seated near a ceiling-type air conditioner, which blew droplets containing SARS-CoV-2, the virus that causes COVID-19, toward the other people in the restaurant. The droplets traveled more than 21 feet around the restaurant, and the virus moved fast. In one instance, the initial infected person was only in the restaurant for 5 minutes with a person who later tested positive for COVID-19. In another, a person who later tested positive was seated 15 feet away from the infected person. The researchers concluded that droplet transmission can occur at a distance greater than 2 meters, 6.5 feet, if there is direct airflow from an infected person. Based on the findings, the authors recommended updated guidelines involving prevention, contact tracing, and quarantine for COVID-19 to control the spread of the disease.